Video on demand, fact versus fiction, folks. Right there. Much more on FoxNews.com.
Well, President Obama meeting with the gang of 6 bipartisan senators from the Finance Committee. They're trying to hammer out a compromise on health care reform before leaving on their August recess. One of the big issues of contention, of course, is the public option designed to compete with private insurance companies. Something Mississippi Senator Roger Wicker calls a bait and switch tactic. The senator joins us now. Senator, welcome to you. I want to just show you this piece of video. This is from a town hall that Steny Hoyer, the House Majority Leader, had, and it wasn't even about health care. Watch this.
You're lying to me.
That's right.
What are you waiting? I don't have sophisticated language. I recognize a lawyer when I see one. It was 53% this morning. That was as of the news.
I didn't say it wasn't what you're
You
saying.
said it was the same as the Bush administration.
I said it hasn't changed.
No, it wasn't. Listen, I'm a registered Democrat. Okay?
Me too.
Why would you guys try to stuff a health care bill down our throat in 3 to 4 weeks when the president took 6 months to pick what he wanted for a dog for his kids? Where was it going?
As you can see, that was about the rail system, by the way, turned into a debate on health care. This is happening more and more across the country. The Democrat senators say, look, these are just shills, okay? These people, this is not a grassroots movement. But doesn't it make sense to you that if half the country is against this health care plan, that a lot of these town halls are going to be filled with a lot of people who are angry about this?
Well, this is not hard to figure out. When we first started talking about health care reform, no one understood that this was going to be a huge tax increase for middle America. No one understood that this was going to take people who are happy with their insurance product and put them in a government plan. I don't think senior citizens realized that there were huge hundreds of billions of dollars of cuts in Medicare to pay for this new government-run program. So as people are beginning to hear about that, I think it's actually more than a majority now who are opposed to this sort of thing. And I think we're going to hear from the folks back home, and that's the way the system works.
And it's interesting because if you go behind these polls, and we're going to delve into these a lot more in a little bit, but if you go behind the polls, the reasoning is that everybody in this country said, okay, the premise here is that 47 million of us are uninsured. So, okay, let's get them insured. And then it comes down to, well, we're not just getting them insured. Now it's changing my insurance, and it's going to cost me money to get those people insured. So this was not as advertised back in March when the president began rolling this out.
That's true. It is a bait and switch or a Trojan horse. And this public plan, you can ask the leading economists, and they will say there's no way that private insurance plans can compete with a government-run plan where the government can print more money and borrow more money at will, as we've been doing the last several months. Right. So what will happen is more and more people, if we go into that plan, will have to be forced into the public option because the private options will dry up. And we don't want the waiting lists of a Canada-style program. We don't want the rationing of a Great Britain-style health care program. Senator, and I think that's where we're headed if we don't stop this train and slow it down.
Senator Wicker, thank you, sir.
Thank you.
Well, someday